and how it came about. And then, of course, we'll talk about our mission and research. So I am a clinical assistant professor in speech, language, and hearing sciences in the College of Public Health and Health Professions at UF. So I wanted to give you a little bit about my background. So I was a former rehab speech therapist in a hospital-based clinic or clinics. And I ended up starting out with adults, but I worked with birth to end of life. When they found out about my first career and my background with language acquisition, children started appearing on my caseload, and then I ended up being peds to end of life. So I also taught for a short time at Jacksonville University. I helped them start their speech pathology program, and it was funded by the Brooks Rehab, where I had worked as a therapist. And but prior to that, I devoted over 2 decades of my life to language. And specifically, when I left UF, it was not because I didn't love UF, it was because I transitioned into healthcare. So for over 2 decades, I was a associate professor of Germanic studies. I was the TA supervisor. I ran our German and Dutch language programs. I taught second language acquisition courses, as well as literary, cultural history of Germany and Germanic countries. And I ran for many years study abroad programs, and the program that I was most attached to and spent the most time was in Utrecht, the Netherlands. So you might wonder, like, why is all this important? Because language and culture have always been a part of my career, and study abroad programs with Germany, Austria, and the Netherlands exposed me to lots of different people and also different medical systems. And also as the program advisor and TA supervisor for Dutch TAs from the University of Utrecht, I gained a lot of knowledge on how their system works. So in clinical settings, I also worked with children and adults whose first language was not English in a variety of situations, especially when they knew about my language background. So now on to the lab. Our lab, sort of the lab started out for different reasons. But what I'm going to talk about in our lab or today is the inception, the mission, and the research. And so when I say for many reasons, one was my chair approached me and he said, you've been working with lots of other labs, but you put a lot of energy in helping different colleagues support them with their labs. How about you have your own lab? And since you're very passionate about languages and bilingualism, how about you start your own lab? So that's how it came about. Basically, it was that and representation. And you'll see in a few minutes about the representation in terms of different populations, but Spanish in particular. So the main real reason is we are the flagship university in the state. And as my chair clearly stated, and of course he was right, that we have a lot of Spanish speaking students and Spanish speaking population in the state of Florida. Why not have representation? So representation, it was and still is, but we started out with Spanish speaking, and we ended up with Turkish, Finnish, Arabic, Vietnamese, and the list goes on. And the other thing was mentorship. So mentorship, in terms of fostering undergrads in a large program, our classrooms are very large. We have anywhere from 30 to 40 students in a class. And so mentorship and getting to know students is difficult when you teach, different classes with large numbers. And so this was a way to get to know students in a more in a smaller environment. And then what we wanted to do was promote bilingualism and of course the use of heritage languages, and be an awareness of health concerns as an outreach, especially for those populations with limited English proficiency, and also the impact of culture on health decisions. In my former career teaching Germanic languages, culture and language always went hand in hand. And we, in my current field, we focus so much in medicine on and rehab science on that which is needing addressing. And we focus, of course, a lot for us on language when it's a language issue, but we often don't necessarily include culture. We are now more and more, the field has been highlighting the importance of culture and cultural proficiency, but it is something that with the heavy curriculum of our students, they don't automatically get a lot about the cultural variability in their patients. And then, of course, undergraduates to have, with no experience in research, we wanted to have a safe place. And then I'll talk more about mentorship roles, productivity of the lab members, and accommodating a large group. So that is the inception, the mission, and the research. So here I am in front of our lab. I included in this, in case anyone wants the PowerPoint, I'm very happy to share it with you. If you click on to BLAU, is the Bilingual Language Access and Outcomes Lab. And the title actually came when we took the title and we made it an acronym. It comes out to the meaning blue, which is a very calming color in two of my favorite languages, two of my favorite languages, current favorite languages, which happens to be German and Dutch. So they're spelled differently, of course. So anyway, I'm pointing to the design. Everything, including our mission and design of our logo, was all done by my students. So here I am. And I always keep my subtitles on Spanish because I have a Spanish-speaking virtual exchange partner in Guadalajara, Mexico. So they say their English is good, but just in case with, technology, right? So my lab is located in our hospital over by the dental tower, the tallest part. And if you click onto my website, you'll see us all crammed into the space where we have enough room for a couple of tables. We have our own laptop and we have a little iPad. So we have everything we need. And we're very grateful for whatever space we have. And my students are too. They decorated with the flags and whatnot. So the inception, as I said, came about with the representation of the Spanish-speaking population in the state of Florida. And as I said before, we wanted to expose our students to research, and already starting at the undergraduate level. And then I wanted to explore mentorship roles. And I have to really credit my chair. I don't think he's able to make this Zoom, but he is my role model for mentorship because he has very unique way of mentoring his faculty and his graduate and undergrad students. So he came up with trying to incorporate mentorship and the lab and teaching sort of all together, as one research feeds teaching, and and undergrads need to be exposed to the importance of research, especially in our field, because our rehab services and our therapeutic services are all based on evidence-based research. So research is a fundamental pillar in our field. And And so exploring different ways to mentor to increase undergrad understanding of research and also to increase productivity as well. So if we look at the numbers, and it's a really large population in South Florida of the Spanish speaking, but I got this from a Florida document and I thought it was pretty appropriate because it shows from 2010 to 2020 the total population growth and of the Latino population. And as you can see, it's just growing incredibly fast. And if you see how it's growing faster than the non-Latino population, and you can see that clearly in this chart. But if we also take a look at the languages spoken at home in the US, and I know that linguistics students most likely they definitely are clued in on that. And so are my students, because a lot of them also come from those populations. But the 5 most commonly or frequently spoken languages other than English in homes, this is taken from the US Census 2019 Bureau. And you can see at the top you have Spanish or Spanish Creole. And then right behind it, our Asian population, speaking populations are growing too. Chinese, Tagalog, and then Vietnamese. And I can say from my lab, I've learned that there is a rather larger, well, I don't know what percentage, but we do have a good representation of the Vietnamese and Arabic populations in Jacksonville, not far from, obviously Gainesville. And as you go further south in the state, you encounter more Spanish speaking and Haitian Creole, I believe, as well. So I'm very proud of our mission statement. All of this was created by my students because of my views towards teaching and mentorship. I wanted students to realize that they have a voice and that if we create a mission statement with their input, they're more likely to be invested in the lab. So they came up with this, and of course, I obviously had to approve. But our mission is basically, statement is that Blau is composed of students passionate about their studies in communication sciences and disorders, hearing sciences, public and global health, and education, among others. We collaborate with professionals from these fields to execute our projects and gain wisdom from those with real-world experience. Since this was drafted, we had originally CSD students in our lab, communication science disorders, but it has grown, and now we have students who are going to become doctors, nurses, and others who are interested in languages. So we have some people who are interested in Spanish and health and so forth. And so they also came out with, they wanted to highlight the importance of bilingualism and understand what the outcomes of minoritized populations in our country, is like, and discover equitable solutions for any health disparities, and also recognize the importance of and impact of culture on language, support second language acquisition, and then engage in problem solving both on the local and global levels. So our mentorship flow looks pretty much like this. So I'm the director of the lab, and I oversee, all the projects, and I help to guide students, and I provide that high-level mentorship, either one-on-one or in small groups. And then the seniors are first-year master's students, so they start out as juniors, and then they'll end up being involved as best as they can in their first year of graduate school if they end up in our graduate program. And if not, then they graduate and go on. But the more advanced students, they conduct more advanced research. So what that means is they might start out helping with the lit review and understanding what a lit review entails. And then as they gain more experience in the lab, they'll end up collecting and learning how to collect data. And then those more advanced, they will mentor the newbies, like the first and second year undergrad. So first and second year, I don't mean freshman and sophomore, but now I am getting younger and younger ones. When I say younger, at first I was only getting juniors and seniors. Now they're starting, finding me in their freshman and sophomore years. And then they act as a nice little bridge between the lab, me, the director, and the undergrads. And then if you take the, first years and second years, the ones who are just starting out, so if we were to do it as a flow chart, you would see that on top would be the director and then the advanced researchers, and then on the lower level would be the undergrads starting out. So they're learning some fundamental research skills, and they assist with projects that the more advanced researchers are doing. And so what they end up doing is gaining some hand-on experience. And then they find a place to belong on campus and contribute to the medical field. And I'll go on more about finding a place to belong on campus. So what does that actually look like if we, pull out all the words? Because today, we are very much a visually oriented society. And so I'm also inspired by my colleagues who belong to the deaf and hard of hearing community, because they're visual processors, and those from the deaf and hard of hearing community, if I'm not mistaken, they can process visual information twice as fast as those who belong to the hearing world. So anyway, what it would look like if we were to visually represent that, this is exactly how it would look. So you have mentorship, which is very essential. And, and overlapping with that is engagement on various levels with various people. And then from there, the individuals, by designing their own logo for our lab and coming up with their own mission statement, they're also acquiring an identity. The lab, we also do, once a semester, we try to do at the end of the semester a dinner to celebrate, the undergrad research day or whatever achievements from the semester, and I let them pick a restaurant of their choice. And so basically in the very center of it all is research productivity. So when you combine sort of mentorship, engagement, identity, and you have a mission with a certain research goal in mind, you end up basically with being pretty productive. So now on to like the kinds of research we do and how that the role that plays. So I have to start out. I know it probably would have been all right. I left out the picture of her, but if you zoom in, you can see the name. So this was the very first members of the lab. And this young lady had been in my undergrad class and said to me, I've never done research before, but I'm kind of interested in learning more about research. And so I said, okay, well, and I quote her, I never did research before and nobody in my family did research. And I don't know if she, was the first to graduate from college. So please don't quote me on that in her family. But so I said, well, we'll start and roll up our sleeves is always a place to begin, which was the independent study, which led to an honors thesis. And so in long story short, the student not only conducted research, she did the lit review, she did a Qualtrics survey, she created density maps and plotted her data with mentorship. And her mentors at the time were Dr. Sterling Sheffield and myself. Dr. Sheffield's an audiologist, and what we did, well, what had done is a study on speech perception, and then first study was on speech perception of heritage speakers of Spanish, and then our second study that we did um, with this student was on how a Qualtrics survey on how students use language, the impact sort of language use on heritage speakers of Spanish. So that was her honors thesis. And I believe she won the Dean Scholar Award from our college for her paper. So here we go. We have a student who is bilingual too. So she was interested in bilingual. She is a bilingual heritage speaker of Spanish. So I was going to use the quote, necessity is the mother of invention. And when I went looking up that, I found out this, that actually it is curiosity. While I kept trying to find the source, because I always wanted to come up with something, we always would attribute, it to Germans, because my dad would say, Germans are the mother of, they coined the phrase, or they coined the term, necessity is the mother of invention, especially after the war. But in reality, when I looked up, I don't know who really did it, but this quote seemed to be more fitting because it was more, modern, 1917. And I loved it because it's the curiosity, the outgrowth of pleasurable intellectual curiosity. And that intellectual curiosity is what drives inventions and coming up with solutions to problems and cures for dangerous and horrible diseases. So when you have limited resources, that's where mentorship, technology, and you don't need a lot of resources necessarily. Of course, you have to start small, which is what we did, and we hope to get bigger. But we started out with a space and a name, and we created and grew, and we started applying good mentorship, strategies. So the other piece of this whole equation for the lab, which I feel is extremely important, and that is having a sense of identity and belonging. So there is an article that came out, it was written by a graduate student in our ASHA leader is the American Speech Language and Hearing Association. If it's a link that if you click on, you can read the article, and the article is called Our Clients Are Diverse. Why aren't we? And so what does that mean? And you'll see in a few minutes in one of the posters or a couple of the posters that are being presented, it's extremely important because only about 8% of our ASHA members. Now, why is ASHA important? That is our governing agency. So I am a licensed speech language pathologist for the state of Florida. In order to deliver my therapy services, I have to have a certificate of clinical competence. And that's part of my education for becoming a speech language pathologist. And we have to be a member of ASHA to be able to practice nationally and in our state. And so the ASHA leader is trying very hard to have as best as possible as much representation of the populations that we treat in clinic, and you'll see in a few minutes why. But basically, under 8% of ASHA members and affiliates self-identify as racial minority, and 4.7% self-identify as Hispanic. additionally, only 5% of ASHA members and affiliates self-identify as bilingual service providers. So when we talk about representation, when it comes to health, that is extremely important. So if we take a look very closely at the sample presentations that we have coming up in our public health and health professions research days, these are the different presentations. These aren't all. I have 10 in total, but I just included the ones that I thought would be most representative of, what we're talking about today. And also reflect the engagement with other professionals. The first one, even though it's not definitively on bilingualism, in a sense, it does intersect with clinical and bilingualism, because this was inspired by my virtual exchange partner at the University of Galway in Ireland. They are the only bilingual university in the Republic of Ireland. And my partner and I, we work on speech sound disorders and in special populations. So this young lady, this individual who is presenting was inspired by our virtual exchange with our virtual exchange partner from Ireland last year. And it will be helpful for dealing with children whose articulation may be influenced by the phonology from their, first language. So another presentation is on colonization, carbs, and cardiac arrest, the Native American health crisis. When just to put it shortly or briefly, and you're all welcome to come to these presentations. I can provide the schedule if you like. But when the Native Americans were colonized and their diet changed and lots of other things, they became more vulnerable to diseases like diabetes and other cardiovascular. So that's a healthcare concern, right? A survey analysis of healthcare communication assessing the impact of bilingual providers versus interpreters on patient experience. This study was done to assess what patients preferred. Do they prefer having an interpreter, or would they prefer to have a doctor or a nurse or a speech language pathologist or a physical therapist or a, I don't know, dietitian speak their language or have an interpreter? You'll have to come to our poster presentation to find out the answer to that question. Understanding the underrepresentation of Southeast Asians in the communication science and disorders field. This really goes back to what I said. You'll see in a few minutes why representation is so important. This takes a good look at why this study takes a very good look at why there is underrepresentation. And that is because that a lot of Southeast Asians don't understand what speech pathology is or what field involves, then you're less likely to find the benefit of going and seeking therapy services after you've had a stroke or after you've had a traumatic brain injury, or maybe when you're experiencing cognitive decline. Healthcare interpretation and miscommunication among people with limited English proficiency. So that's a huge concern, of course, that if language is a problem and we don't have enough interpreters, and the individuals treating the patient, the healthcare providers are not confident in that language, then that can create a lot of miscommunication. So I'm going to digress with a true and short anecdote. So long before I became speech language pathologist. I was running our program summer study abroad in the Netherlands. And one of my students during orientation had a healthcare crisis on day one and pulled me aside and said, Dr. Difino, I think I need help. And I said, sure, what can I do? She said, can you make me an appointment with the doctor? And I said, sure. We'll do it right after the orientation and I'll help you with that. So we, she called, and of course, I'm trying to respect her privacy, but she ended up needing my help. And as program advisor, she gave me permission to help her make the appointment. And then she requested that I attend the appointment. So I went to the appointment with her, and the doctor, his English was pretty good, and I've really seldom encountered Dutch speaking people or Dutch citizens who do not speak pretty darn good English. So it was a very sensitive matter. In fact, it was one of those where he needed to investigate her, and he wanted me present, and it would have required, her to get undressed. So I told her, or I told him, and I told her because she felt insecure without me. And I told him that and he felt insecure without me. So I used the strategy that we use later in clinic, and that is, I said, how about you leave the door cracked open and I listen and I don't have to see anything. And if you have a question on how you say the word in English or Dutch or whatever, I'll be your interpreter. And that's the truth. I never would have imagined that long ago that I'd end up truly understanding what that meant. So that's just a small example where you can have miscommunication in a situation. Now, of course, we were abroad, but it can happen here, right? And then the other presentation that students are working on, and I'm really proud of this one too, is bridging communication gaps. I'm proud of all of them, sorry, all of them, but this one has a special meaning too, because we're looking at enhancing language intervention for bilingual children with autism. So this is especially important because promoting bilingualism and helping parents make the decisions if their children, present with Down syndrome or are on the spectrum or have an intellectual disability of some sort, that we want parents to feel like if they want to promote their language at home and bilingualism with their children, that we want to help them with that, because it's important. But also the other important part is we actually have a student from the University of Central Florida who is part of our lab. She found our lab. I don't know, she must have been Googling, and she herself is bilingual. So she's part of our team, and she will be coming up from Orlando for that. So basically, we've created quite a team doing a variety of topics that all intersect. And my team is made up of such an interesting group of individuals. We had representation from just about every Spanish-speaking country, or students who have studied Spanish and have visited one of those many Spanish-speaking countries. We have students who are Cuban American, Colombian American, and the list goes on. And we have students from we have a student from Finland. We have students who are from all over. Like I said, from Asia, Africa, pretty much representing almost the entire globe. Well, we don't have any Australians, but you know what I'm saying. So my team also, again, came up with a wonderful idea. They said, Dr. Difino, our research posters are very much geared towards a academic audience. And if we really want to be helpful to and get the word out, we need to have a podcast that addresses concerns that we research, but our podcast does not reflect the opinions of our department or the University of Florida. It's their opinions and based on whatever reading or they've come up with research or their research that they've boiled down so they could present concerns and make people aware of bilingualism, all things bilingual. Our first real podcast addresses talks about debunking the myths of bilingualism, and the other podcast that will be coming out next week is to look at cardiovascular disease and women's health. So we have an ultimate goal, and that is it all translates out to creating positive outcomes, right? So patient advocacy leads to positive health outcomes, positive health outcomes. So I want to thank you for giving me this opportunity. I also included, just in case anyone was interested, a link to strategies for group level mentoring of undergraduates. I just found this, and I read through, and pretty much some of the strategies, I think I'm using, but I will use more to increase funding, because that's our next big goal. So I think I'll stop here and then let us open up to any questions or discussion of any sorts.